All right, so I know we only have an hour and we have a lot of information to share today, so I think I will go ahead and start. So hello, everybody, and welcome to today's webinar entitled Better Together. I would like to start by acknowledging that we are standing on unceded Algonquin Anishinaabe territory. My name is Stéphanie Fragman, and I will be moderating this event today. For those who do not know me, I'm the Director of Family Services at the Vanier Community Service Centre, and I'm very proud to oversee the operations at the Hub with a lot of support from other people as well. I'd like to start off by saying that since the Vanier Community Service Centre is a Francophone agency, we would have liked to facilitate a bilingual webinar, but recognizing that this was not possible in the time allocated, the presentations today will be in English only. Questions, of course, I think if we could put the slide on how to use the questions, that would be great. So questions, of course, can be asked in either French or English using the Q&A button on your screen. These questions will be addressed at the end of the webinar. You can also use the chat button to share information with the group or privately with another participant. The webinar is also being recorded, so it'll be available for future viewing. Le Centre des services communautaires Vanier étant un organisme principalement francophone, nous aurions souhaité offrir un webinaire bilingue, mais reconnaissant que cela n'était pas possible dans le temps alloué, les présentations d'aujourd'hui auront lieu en anglais seulement. Les questions pourront cependant être posées en français ou en anglais en utilisant le bouton Q&A que vous voyez à votre écran. Ces questions seront adressées à la fin du webinaire. Vous pourrez également utiliser la fonction chat pour partager de l'information avec le groupe ou en privé avec un autre participant. Le webinaire sera également enregistré et disponible pour un visionnement ultérieur. So our original intention was to have a live community event back in the spring at the end of our 3-year pilot project, which ended in December of 2019. But then, of course, as we all know, COVID hit, and we obviously had to postpone that event. So rather than wait for restrictions for indoor gatherings to be lifted, as this may unfortunately take some time still, we decided to offer the event in this virtual format, which everyone has gotten used to now. So we hope that you will enjoy our speakers today. So we will have 3 speakers covering 3 topics, and each speaker will speak for approximately 10 minutes. And as the moderator, I will do my best to keep everyone on track so we can all end on time at noon. So our first speaker, Dr. Sue Bennett, will briefly describe activities at the Vanier Social Pediatric Hub with a focus on the challenges that families are currently facing due to the COVID-19 pandemic. Our second speaker, Dr. Alison Krentel, will present the key findings from the impact evaluation of the Vanier Social Pediatric Hub after 3 years of operations. And finally, our final speaker, Michel Gervais, will talk about the importance of the model for our community. But first, we're going to take a quick poll to see how much our audience knows about the social pediatric model. So if we can get that poll on the screen. So you have how familiar are you with the social pediatric model? Hopefully everybody can see that on the screen. If you could just pick your answer there, and it'll give us a sense of who's in the audience and what they know. I'll just give everyone just a quick minute or so, probably less than a minute. Wondering if that's probably enough time for everybody to vote on that. So I'm not sure how to get the answers to that, but hopefully the people in the background can do that. Okay. Oh, interesting. So I'm not familiar with the model, 42%. I know a little bit about the model, 29%, and very familiar, 29%. So most of the people don't know that much about the model, which is great, which is hopefully you'll learn a lot while you're here. So thank you for joining us. This will be especially interesting for those who know less about the model. And I just lost my notes here. Okay, here we go. Just to help gain a better understanding of the model, I will share a short video with you all provided by the Dr. Julien Foundation. So Just a reminder that the social pediatric model was developed by Montreal pediatrician, Dr. Gilles Julien, and that there are over 40 social pediatric centers across the province of Quebec, including 2 that are very nearby in Gatineau, as the Quebec government has identified this model as a best practice. The Vanier Social Pediatric Hub is the first and only center in the province of Ontario as we speak. So the video will give you a short glimpse into the kinds of interventions we offer our families. So you can go ahead and hit that video, that would be great.
Melissa is 10 years old. Her life is not easy. She shares a chilly, unhealthy apartment with her mother and little brother. She always has a cold. Her mom works at night and is seldom around to take care of her. Her father's behavior has been violent. The authorities have ordered him to stay away. Resources are scarce. A youth protection worker is already involved with them. Melissa doesn't sleep well and has dark, suicidal thoughts that worry people close to her. She cries a lot at school and doesn't pay attention in class. Her marks are terrible. She has recently developed behavior problems and is often absent from school. Her teacher suggests a meeting at the Community Social Pediatric Centre to find out what she needs and to set her up with coherent services. In order to come up with an overall picture of her health, the social pediatrics team bring together Melissa, key adults, and professionals already involved with her. In an informal setting, Melissa's voice is finally heard by everyone, and each person describes how they are involved with her. Everyone becomes aware of the difficulties Melissa faces. Many of these problems prevent her basic needs from being met and her rights from being respected. The meeting also highlights Melissa's many strengths. She is sociable and assertive. She is a very responsible child. She clearly expresses her wish to succeed in spite of the obstacles and shows a lot of interest in drawing and music. A range of resources are mobilized to get at the root of Melissa's difficulties and tackle the obstacles she faces. The doctor diagnoses her various problems. The social worker gets involved with Melissa's mother to find better ways to support her daughter. The lawyer provides assistance to address the problem of the unhealthy apartment. The art therapist helps Melissa to better understand her emotions. Volunteers help to make the most of her potential through drawing and music classes and lend a hand with homework. External partners are just like Melissa. Thousands of children are at risk and face many obstacles harmful to their health and development. All these children will grow up to become adults who are expected to contribute to society. Community Social Pediatrics aim to provide all children with the same opportunity to develop their full potential. They will then be able to take their place in the world on an equal footing.
So hopefully that gave you all a better idea of what we do, but as our presenters will present, you'll get a better sense as well as to what we do specifically at the Hub. So without further ado, I would like to present our first speaker, Dr. Sue Bennett. She is a full professor in the Department of Pediatrics, Faculty of Medicine at the University of Ottawa. She is a pediatrician and mental health professional by training and the Director of Social Pediatrics at the Children's Hospital of Eastern Ontario. There's something still playing. Is that still the video? Oh, thank you.
Presented.
She's Director of Social Pediatrics at the Children's Hospital of Eastern Ontario after more than 2 decades as Director of the Child, Youth and Protection Program, working clinically with maltreated children, youth, and their families. She is a prominent advocate for the rights of children, youth, and their families, and conducts research and education in promoting child health and well-being at the local, national, and even international level. She is a director of the board of the Royal College of Physicians and Surgeons International and a counselor with the International Society for the Prevention of Child Abuse and Neglect. Finally, Sue has been the medical co-director of the Vanier Social Pediatric Hub since its inception in 2017. Off to you, Sue.
Thank you so much, Stephanie. I'd like to give you all a brief introduction, stressing brief, to the service we provide to children and youth and their families at the Vanier Social Pediatric Hub. Now, the Hub presently cares for approximately 100 children and youth who live in about 70 families. We take referrals from anyone, including self-referrals for children and youth less than 18 years of age, who are experiencing complex psychosocial issues and living or going to school in Vanier K1L postal code. As many of you are aware, Vanier is a richly diverse and underserved neighborhood, significantly vulnerable on many demographic factors. Next slide, please. And next one. November 20th last week was National and International Children's Day, celebrating the adoption of the Convention on the UN Convention on the Rights of the Child by the General Assembly in 1989. The expression "think global, act local" is a fine example of bringing the principles of the convention into practice at the Vanier Social Pediatric Hub. Next slide, please. The convention is the blueprint for the holistic care of the whole child, whose biopsychosocial and spiritual well-being is at the very core of our work at the Hub, with recognition that a child lives and thrives to their fullest potential within a supportive family, community, and society. This ecological model is framed by the Convention's key principles of non-discrimination, that's for all children everywhere, and their best interests and full participation in all matters affecting them. The Convention sees children as full human beings, not human becomings, with human rights and agency, and not as passive objects of charity. Next slide, please. The Hub is much more than the Anglophone and Francophone medical clinics, which we run on a regular basis. And with recognition of the importance of the social determinants of health for optimal healthy development, we have developed many activities for our multicultural families included here, which you can read. The Hub is also a site for education of multidisciplinary trainees, and our pediatric residents and medical students are presently conducting research on social prescriptions and the impact of the arts on health and well-being, with prescription to orchestra music programs and free passes to the Museum of Nature and Museum of Science and Technology for the families as well. Next slide, please. I think that's the wrong way. No, I'm sorry. I used to have another slide. Sorry, could we go back? We are talking about the present stress of COVID and the impact on our families. The COVID-19 and the public health restrictions arrived in mid-March, at the same time, coincidentally, that our 3-year Ontario Poverty Reduction Strategy startup funding ended. And in that process, we lost our second social worker, as well as our only nurse practitioner. And the part-time pediatricians returned to the hospitals. Vicky Roy, the full-time social worker, and I looked at each other and wondered how we were going to care for our already isolated and high-needs families. We started contacting the families by phone to see what their needs were and how we could help, and it soon became very apparent that the prime needs were for food. At that time, the food banks were becoming depleted, they had closed for walk-ins and appointments had to be made, and access was only anyway on a once-monthly basis. As well, the schools were closed and there was, of course, no breakfast program, which many of our families depended on. With the can-do attitude that characterizes our Hub staff, Vicky said to me, "Okay, I will make the soup." And I said, "Okay, we will deliver to the families and check in with them." Clearly, that would have been an impossible task on a weekly basis. And it was serendipity that I was approached by several third-year medical students looking for clinical experience as they were no longer allowed in the hospitals. And thus the More Than Just Soup project was born. This proved to be a win-win for families getting their needs met and for the Hub staff with significantly decreased resources to continue to care for our families, and indeed for the medical students to truly understand experientially the impact of social determinants of health on the children, youth, and their families during this crisis. A shout out to our Hub receptionist, Esther Nagy, who smoothly coordinated the More Than Just Soup project. Next slide, please. This is a busy slide. You just can read the heading. because I just want to give this as an example of the students' scholarly output, which was incredibly impressive. And this poster was presented at the Canadian Conference on Global Health last month. There was another poster on the use of home visits to bridge the growing socioeconomic gap at the Canada Children's Healthcare Conference last week. And we have a publication coming in the upcoming edition of the Journal of Medical Education and Curricular Development, proposing the integration of social medicine electives in medical school. Next slide, please. We had 2 groups of 8 medical students, the first group from March to the end of June, and then the second group over the summer. Each student was assigned 7 families to visit on a weekly basis to drop off food and to get to know the children and their parents and do a check-in for their needs, whilst respecting public health guidelines, which essentially was physical distancing, doorstep visit, wearing masks, and giving the families an option of a subsequent phone call if they needed to discuss sensitive issues. The food was donated from local supermarkets and restaurants. And as well, we partnered with the School Breakfast Box program, and we were able to deliver their boxes as well to each child. The students were able to address parental anxieties and concerns and provide educational resources on public health guidelines, parenting, home online schooling, and address families' social legal issues, finances, respite services, as well as assessing home safety. After the visits, the students would report back to me as their supervisor for discussion, and we would develop an action plan, including possibility of making referrals to Vicky, our hub social worker, connecting with primary healthcare providers, schools, and other supports in the community. A survey of all the families at the end of August revealed that they were really appreciated not only the food, but also a check-in at the same time every week, at a time when they were being told by government to stay home. The children really look forward to the medical students' visits, receiving their own breakfast boxes and the activity kits that Alison and Vivian Runnels and others at Bruyere were able to supply from crowdsourced funding. In September, with the children back at school and its opening of the hub physical space for in-person visits, we discontinued these home visits. However, we're finding now that the families are reticent to visit the hub clinic in person because of COVID concerns, and they are generally not set up for virtual Zoom visits. And anyway, it's very challenging to speak with children by the phone. As well, Vicky and our new nurse practitioner, Vanessa, have noted that many of the families are still food insecure. And so we have decided to start up the home visits again with a new group of first-year students in a couple of weeks' time. In the conclusion from this very brief introduction, for this showcasing our model of innovative service, caring for marginalized and already challenged children, youth, and their families during a pandemic crisis, I'd like to, in particular, thank our CHIO Pediatric Department Chair, Dr. Kieran Duffy, who has provided visionary leadership and support for pediatricians in the development of the Vanier Hub, and indeed the development of social pediatrics as a discipline at the Faculty of Medicine, University of Ottawa. Thank you. I'm available for questions at the end if we have time.
Thank you very much, Sue. So I'll go ahead and introduce our second speaker right away. So our second speaker, Dr. Alison Krentel. She's been a researcher and consultant in public health for over 20 years, working in over 14 countries. Her research interests include facilitating community engagement, the use of implementation research to support health systems, and the translation of research results into programmatic action for effectiveness and equity. She is an assistant professor in the School of Epidemiology and Public Health at the University of Ottawa and an investigator with the Bruyere Research Institute. She holds an honorary fellowship with the London School of Hygiene and Tropical Medicine. She is a senior research fellow of the World Health Organization Collaborating Center for Knowledge Translation Technology Assessment for Health Equity. She received both her Master's of Science in Public Health and her PhD from the London School of Hygiene and Tropical Medicine in the UK. She has worked as a consultant for the World Health Organization, the Pan American Health Organization, UNICEF, and the Task Force for Global Health. Alison is one of the co-founders and the current chair of the Canadian Network for Neglected Tropical Diseases. And last but certainly not least, Alison was hired by the Vanier CSC in 2017 to conduct a 3-year implementation and impact evaluation of the Vanier Social Pediatric Hub. It's all yours, Alison.
Thank you very much. Thank you. It's too much. Anyway, great to be with everyone today. And thank you for the opportunity to present just some of our results from the impact evaluation of the Social Pediatric Hub that Sue and Stephanie have been speaking about. So I'd like to first mention that I represent a team and would like to highlight the engagement of Dr. Vivian Reynolds, who is really my co-partner in all of this. So appreciate her and want to highlight her, and also Justine Diocampo from the Parent Resource Center, who was also instrumental in our results. Next slide, please. So I only have 10 minutes. So as Sue said, I'm going to give you a very brief sort of 30,000-foot view of our impact evaluation. I'm just going to give you a little bit of the methodology that we used and some results, particularly the overview of our client demographics, the children and families who use the hub, and some of the lessons that we've learned in the impact evaluation, with some conclusions noted at the end. Next slide, please. So noting that an impact evaluation determines the program's effects or outcomes, or the impacts on the target population in particular. An impact evaluation may be broadly interpreted, and it may incorporate impacts other than those of the target populations. And you'll see that comes into play when I describe our methodology. We used the Vanier Social Pediatric Hub program logic model as the basis for our evaluation questions. And we won't have time to cover all of these aspects today, but I wanted to just show you what our guiding questions were for the impact evaluation. Next slide, please. So we used mixed methods research, and it took place in the last quarter of 2019 with the write-up and analysis in January 2020. So obviously before the COVID restrictions were in play. So the activities that we evaluated came in before some of the activities that Sue described in terms of the soup delivery to the households. Next slide, please. So the data that we collected, the quantitative data review was done by the Parent Resource Center, and it reviewed routine data that was collected by the Hub team. In terms of our in-depth interviews with key Hub staff members and partners, this was to the pediatricians, the nurses, and also members of the Vanier Social Pediatric Hub team, as well as partners that work together with the Hub. Our parent interviews or caregiver interviews, we targeted 5. Originally, we had thought we would do focus group discussions, but we realized that this was not an appropriate methodology for this population. And so with our in-depth interviews, we aimed for a sampling frame that would include some representation from some of the families that we see, including newcomers, Francophone families, English-speaking families, and Arabic-speaking families. Our partner survey was an online survey that was sent to over 40 partners of the Social Pediatric Hub. We had a fairly good response rate for an online survey, just over 50%. And our micronarrative surveys were offered throughout the lifetime of the pilot project to provide insights into the observations, feelings, and experiences that individuals had while visiting the Hub. The themes that we used in terms of the evaluation included the awareness of the Hub, questions around child health and development, acceptance of the child-focused clinical treatment or social pediatrics, supports and services referrals, understanding about health, access to services, and social determinants of health, among others. Next slide, please. So I just want to highlight very briefly some of the demographics of the clients that are coming to the Hub. It is a multilingual population, as you can see from the table here. An important percentage, over 15% of children coming to the Hub were new immigrants to Canada, and most of these, around 63%, were arriving in 2017. We do have more boys in the client population than girls. And most children are between the ages of 7 and 12, with children as old as 17 having come to the Hub. Next slide, please. Next slide, please. Okay, so I had a slide on family composition, which didn't quite come out, but I'll just tell you about it. Nearly 50% of the families that are coming to the hub are single family households, which is similar to the numbers for Vanier in a 2016 census. 79% of the families coming to the hub are from low income households. This is actually a higher proportion than the census data for Vanier. This slide shows the referral to the Social Pediatric Hub, and there's a range here across physical health, behavior education, and mental health and well-being. The top 5 most often reported reasons for referral were financial situation, fear, anxiety, stress, mental health, aggression or anger, and impulsivity. And most of our referrals, around 46%, come from schools. Next slide, please. So what has been the impact of the Social Pediatric Hub in Vanier? And I'm going to give you quotes and insights across the different data collection platforms. So you'll be seeing perspectives of the staff, parents, children, and partners. Next slide, please. So gaining trust is key to the success of the program. The Vanier Social Pediatric Hub staff works very hard to gain the trust of the families they serve. And this is really felt by the families who perceive a different kind of service in the hub, the inviting environment, the relationships, the breaking down of barriers between the clinician and the patient. And for those of you who've not seen it, the clinic room is a table with chairs around it. So it really is a completely different environment than you would have in a doctor's office. And that's the primary focus of the space. These efforts have resulted in parental confidence in the program. This significant time is needed to establish this trust. And on average, a child coming to the hub in our measurement has about 2.5 visits with a maximum of 15 visits. The average time spent with families is around 3 hours per child. Follow-up time, close to 3 hours per child. Hub team in general, and almost 3 hours. So members of the team all have engagement with the families, and this contributes to the high trust that we see between the families and the hub team. Next slide, please. As you've learned, the Social Pediatrics uses a child-centered approach, and this approach was appreciated by the families and the children. Parents felt that this was empowering for their children to be directly heard by the pediatricians, the social workers, and nurse practitioners. And you can see here that the children report also liking being there, and they feel that the people are very kind to them, and they feel that they are being listened to and valued. Next slide, please. Clients also see positive impacts from visiting the hub and using the hub services in their lives. Families report self-confidence and a sense of familial empowerment. They report seeing impacts on their parenting. They feel less stressed and more supported. They were also able to understand their children's problems and needs better, which gave them greater parental confidence. And we also see here parents' observations about the changes in their child's behavioral and psychological health. Next slide, please. You can see here in one of the pictures from our micronarrative survey, a drawing from a young girl. She draws herself, and then she says, for those of you who don't read French, the kind ladies, the doctors, the people here are all very kind. And these were the kinds of stories that we heard in the micronarratives, stories like, it's fun learning how to check your lungs. I found out where my heart and lungs were, was one of the stories we heard from one of the children. The staff were very welcoming and warm and professional. Everyone tried to make me feel comfortable without judgment. The staff was very available for questions I have, and an appreciation of the service being Francophone as well. Next slide, please. The partnership approach was appreciated by those that we interviewed and was seen as a way to improve efficiencies for families and care providers, and to really ensure that families do not fall through the cracks. Because the hub addresses the social determinants of health within its approach, partnership is essential. Families that we see at the hub have housing issues, roach infestations, legal challenges, barriers to services because of language or misunderstanding of Canadian laws, food insecurity, and other complex challenges. And so the hub team has to liaise with its partners to ensure that these needs can be addressed. It takes a lot of time to make these partnerships work, and we logged over the project period over 1,100 professional phone calls made on behalf of families and over 900 professional referrals and hundreds of forms filled out. And I'm quite sure that we've underestimated the total number that were made on behalf of our families. Next slide, please. So some of the key lessons that we learned: the hub is a complex intervention, and as you would have seen from Sue's presentation, there's lots going on. There's activities, there's the clinical interaction, there's social work, there's the partner referrals. There's a lot going on, and it's really needed to address the complexity that these families are living in. We can see that children's medical and social needs change over time, and that really means that the Social Pediatric Hub has to be innovative and flexible in the service and support that they provide. We saw positive impacts on families, staff, service providers, and partners. And we also received some recommendations for further improvement from the evaluation that we did. In our final conclusion, the Vanier Social Pediatric Hub worked well to produce its intended impacts and makes a difference in the lives of its participants. So next slide. My last slide just kind of highlights just some of the complexity and the conclusion that we can make here. So many of the kids, when they come in, they've got ADHD, ODD, OCD, they've got all these. They might be 6 years of age, they're on medication, and what else can you do to help? You want to go into the home and help them with the issues. You want to call a lawyer, get rid of the bed bugs and the cockroaches. A lot of the families we see are at their wits' end. They've tried to figure things out. And the hub has tangible benefits. Being there and being supportive has had a positive impact on our family and on our families. And the impact evaluation has certainly shown that. So we can conclude that there's a need for the continuation and expansion of the Vanier Social Pediatric Hub to continue to meet the needs of the families it serves in Vanier and those in the surrounding area. So in my final slide, just to acknowledge, next slide, please. Just to acknowledge a sincere thanks to everyone that we spoke with, and also just a note to our funder of the impact evaluation. Thank you very much.
Thank you so much, Alison. Very important information. So our third and last speaker, Michel Gervais, completed studies in criminology and sociology and was then hired by the Youth Services Bureau of Ottawa Carleton as a youth worker, and eventually as coordinator of the East End, Ottawa, and downtown units, overseeing youth workers, working with youth and their families, as well as with street-involved youth and young adults. Following social services management training, he accepted the invitation to assume the position of Director of Social Services at the Vanier CSC, and in 1994 assumed the position of Executive Director. His avant-garde approach has fostered the development of innovative programs to support children, individuals, and families facing multiple and complex life challenges, such as the Vanier Social Pediatric Hub. Go ahead, Michel.
Hi, everyone. I'm happy to be able to connect with you all virtually today to share with you the social pediatric model, why it's such a great fit for our center, and why it is such an essential service for our community. The Vanier Community Service Centre is part of the Coalition Community Health and Resource Centre, of which I'm co-chair and ending my mandate very soon. And the coalition covers the entire territory of the City of Ottawa. However, as part of the coalition, there are no community health centres east of the Ottawa River and the Sandy Hill Community Health Centres, which is located in the downtown core of the city. As a community resource center, our services include settlement services for immigrants and new Canadians, the Partage Vanier Food Bank, a Francophone legal aid clinic, an Employment Ontario Center and its suite of services, intake and crisis counseling services, programming for families and children 0 to 18, and a variety of community development activities and initiatives, as well as a social enterprise called Gourmet Express. The services offered in the community health center, such as medical and primary care, youth clinics, nurse consultation, prescription renewals, nutrition, and food information, are essential in low-income, high-needs communities like ours. This gap in health services available to Vanier families is what drove our team to innovate and look at how we could implement the Dr. Julien's social pediatric model in this community. We could not have done this without the support from the Department of Pediatrics of CHIO and the leadership and support of pediatricians, Dr. Sue Bennett and Dr. Lee Fraser Roberts, who eventually became the medical co-directors of the hub. Their expertise and their vision have been central to the creation and development of the Vanier Social Pediatric Hub. Through many discussions with them, it became clear that we should build on the array of services already available at the Vanier Community Service Centre in order to tailor a service that would care for the needs of our most vulnerable children and youth, as well as their families, with a holistic and humanitarian approach. In 2016, we received a TELUS grant to lead a child and youth needs assessment of the community. This grant allowed us to interview children and youth through various art contests and surveys and hear about what they identify as strengths in the community and what their aspirations were for their community. In 2017, thanks to a 3-year grant obtained through the Local Poverty Reduction Strategy Fund and managed by Ontario Trillium Foundation, the Vanier Social Pediatric Hub was able to open its doors. And so the Vanier Social Pediatric Hub came to life through a series of incredible partnerships with several organizations that came together to make this dream a reality in our community. I'd like to take some time here to tell you more about these amazing partners we have been on this journey with so far. CHIO has been a pillar in this project from the very beginning, giving us access not only to dedicated, passionate pediatricians, but also to important resources, such as the use of EPIC, their electronic medical record database, the donated medical equipment, and ongoing support from the CHIO team. And for that, we must thank Dr. Kieran Duffy, Chief of Department of Pediatrics at CHIO, who has been very supportive of our pediatricians and the vision for the hub. L'Hôpital Montfort has been another important partner through the involvement of several French-speaking pediatricians that offer clinics to support our French-speaking families, which represents about 1/3 of our families. The Sandy Hill Community Health Centre has played a key role in making this project reality. Since we are not technically a community health center, but a resource center, we do not hire health care providers directly, so we partnered with the Sandy Hill CHC to hire and supervise a nurse practitioner on our behalf through a purchase service agreement. The role of the nurse practitioner is key in supporting our families' health and wellness goals. The nurse practitioner can provide ongoing health support between clinical appointments with pediatricians to ensure that treatment plans are being followed and to assist families on a day-to-day basis with their ongoing health-related needs. Another meaningful partner is Le CAP, formerly known as the Centre psychosocial and La Maison Fraternité, who have recently merged to create a francophone center offering mental health, addictions, and other therapeutic services. Funds were allocated by the Ministry of Children, Community and Social Services to Le CAP for 2 mental health professionals, 4 days a week, dedicated to francophone families seen at the hub. The Youth Services Bureau, Crossroad Children and Family Services, and Rideauwood Addictions and Family Services are other partnering agencies with whom we coordinate appointments right at the hub, so families don't have to travel to access their much needed services. The 4 school boards and our local schools are other key partners of the hub and our primary referral sources. We work closely with school principals and dedicated staff on a regular basis to improve the lives of children and youth. They often sit with the families and hub staff around the table to take part in discussions and contribute to the plan to help our clients achieve better all-around health and well-being. We also work with other agencies such as CS for referrals and collaboration with certain families, and a fun activity with Orchestra, who thrives to empower his kids from underserved communities through the universal language of music, has offered after-school programming to our families at the Hub. There are many more organizations that we work with in some capacity, such as Ottawa Public Health, First Words, even City Museum. I'm sure I'm forgetting some, so I apologize in advance if I've omitted any of you. What this shows is what it truly takes a village to help a child. What we all had in common when taking on this journey was a common belief that all children and youth deserve to achieve their full potential. Of course, the hands-on team working at the Hub is vital to the success of the model in our community. For the first 2.5 years of operation, the Local Poverty Reduction Strategy Fund covered a small team, a full-time social worker, a part-time nurse practitioner, and a receptionist. The pediatricians involved were covered through HOIP on a fee-for-service basis and other forms of support through CHIO. In 2019, we obtained stable funding from the Ministry of Health for one full-time social worker position, while other positions have since been covered by fundraising efforts and small grants. As Dr. Bennett explained previously, the COVID-19 pandemic has increased certain needs among our families and imposed certain limits on our service delivery. Fortunately, we were able to secure additional interim funding from different COVID-related funding opportunities, such as the Ottawa Community Foundation through the Emergency Community Support Fund, which allowed us to extend the nurse practitioners' hours and provide food donations, which have been much needed. Funds for the nurse practitioners' hours and food were also obtained from the City of Ottawa's Social Services Relief Fund. We have also applied for further funds at the Ottawa Community Foundation and United Way in hopes to extend our contract for our receptionists, which is a central role in coordinating all activities and appointments at the Hub, as well as to secure other key positions. Funding remains precarious. We always strive to stabilize funding and are continuously looking for funding opportunities. With increased needs, we cannot continue to support 100 children and 70 plus families with our present resources. We have created something incredible and referrals keep coming in. This confirms we are responding to a real need in our community. And our goal is to keep responding to this need and to make this service sustainable and permanent. But to do so will require additional social worker and continued funding for the reception that coordinates many of the activities and connections occurring daily at the Hub. Our work would not be possible without these precious partnerships, devoted employees, and we are grateful for everyone who shows interest and who believes in this model and in our services. Thank you so much for being here with us today and your interest in the Vanier Social Pediatric Hub. Thanks.
Thank you, Michel. We actually are finishing a couple of minutes ahead of time, which is great. So thank you to all our speakers. We now have about 10 minutes to take a few questions from the audience. But before we move into the question period, our contact info is provided on the slide that you see on the screen. So please reach out to us if you have any questions about the Vanier Social Pediatric Hub, or if you have any ideas for sustainability that you would like to share. The webinar will be posted to the Meilleurs YouTube channel, and the link will be shared with all of you that have registered today. It will also be posted to the Vanier website on the Hub page if you're looking for it. So I do see that we have, I see one, I don't know, it says two, but I can only see one. Hold on, maybe I need to move this. Okay, there are two questions, so I will start with the first one. It says, thanks so much for the presentation. There's clearly a great deal going on at the Vanier Community Service Centre, and it sounds as if you have developed some great partnerships. Can you tell us about the sustainability of the Vanier Social Pediatric Hub? What do you expect for its future? So I know that Michel spoke a little bit about that, but is there anybody that wants to add anything about sustainability on the panel?
Well, I can add that the board of directors of the Vanier Community Service Centre has been very supportive, and it allowed us to, on occasion, direct some funds towards community projects, and I'm hoping we can continue to do that to support our hub. Meanwhile, Stéphanie has made several applications for funds, and we're always knocking on doors and looking for opportunities. I'm hoping that the creation of the new Ottawa health teams and the East Ottawa health team, we can also make connection to acquire some resources, and eventually perhaps they'll in. That's the short-term plan at this time. We're having so far local politicians are very supportive, and we're working with us to help us knock on doors and open doors for continued funding.
Just to say, in Quebec, the model has been institutionalized. I think there are about 55 centers across Quebec, supported partially by the Quebec government. So it's been very successful. They've really appreciated the evaluations of their programs, and that's our mothership that we're using common data collections and somewhat evaluation similar. So we're optimists. We're working with this dream and vision, which we know experientially works, but also with the evidence that Alison et al. And Vivian have shown this really works. So we've got a very committed bunch to continue to work hard to make this sustainable in the long term.
So we have a couple more questions, so I'll go ahead into the next one. So Dr. Bennett gave us a clear picture of the very serious and alarming impact of COVID-19 on the Vanier children and families, particularly on the food insecurity. What are you finding out about the impact of COVID-19, health and other impacts on racialized children and families, please? Does anybody want to take that one?
Well, we've got a very diverse population. We're a minority francophone. We have high numbers of newcomers. We have from particularly the Syrian population, with Middle Eastern population, but francophone Africa as well. So we're really looking at large group of diversely racialized population for the group we serve. We haven't actually disaggregated the data, but we can say that our population is already marginalized in many ways, and in racial terms as well. So I can just say simply, we don't have that disaggregated data specifically.
Okay, the next question asks, thanks for a very interesting session. In the evaluation, were you able to see any difference from the work of the hub on the home environment, violence particularly?
I could just make a comment to say that the Children's Aid Society did note when COVID started and the physical restrictions were in place for families to stay home, they had decreased reports of family violence, and quite simply people could just say, oh, you know, the reports are down, therefore it's not existing. Clearly that's the report, and schools are oftentimes a prime system for reporting child abuse and neglect. So we don't have clearly that information. It's hidden behind the families, and it was important for us to keep contact with the families when the schools were closed, particularly over the summer when we couldn't have contact with even the teachers at that time online, that we remained in contact, not just with the families, but with the kids themselves, that they would know that there was the hub and the important telephone numbers and contacts that families could call if there were safety issues. That was one of the resources that we're able to give them in person. So again, not clear data. We are hoping to actually participate in a UNICEF and young person developed youth. It's actually child and youth from 9 years of age to 17 years. A survey on their wellness during COVID. It was organized and developed before COVID started, but it would provide an important snapshot from children and youth themselves to tell us what's been going on in all aspects of their lives. That requires, again, some funding for us to take that on, but we're pursuing that because I think we need to know from the kids themselves what's going on in their lives and their homes.
Can I just add to that, Stephanie? Within the evaluation, what we learned was the complexity of the population we serve meant that we had to be really innovative with our the methods that we used. And one of the things that we wanted to be really careful was to preserve the trust that existed between the hub and the families. And we didn't want at any time in our evaluation for these families to feel researched. And so to say that, you know, we had to really walk a very careful line. And so we did not investigate issues around violence in our in-depth interviews and in our evaluation. It was not a pointed question that we asked. Rather, we asked more general questions about overall well-being and impact that they saw on the hub, and that sort of was reflected, I think, in the results that I shared. We didn't really ask those really pointed questions, partially to make sure we respected the trust with the families.
So that's actually a great segue for the next question, which is probably directed towards you, Alison, is can you speak more about why you chose micro-narrative surveys as part of your evaluation?
Yeah, so micronarratives, if you're not familiar with that methodology, and I won't bore anybody with it, but it's embedded within a questionnaire, and we used a very, very simple tool. It was about 10 questions long, and I showed you the picture from the young woman. It basically asked them to share a memorable experience about coming to the hub. And it could be drawn or shared as a story. And then there's a series of questions that follow asking about that story. And we made it available to everyone, families, staff, and partners to fill out. And we found it was a really good way just to capture a snapshot of how the caregivers and children themselves were experiencing the hub. And so it's very open. It was anonymous. It was simple. The language was very, very easy. We had it translated into French and Arabic, so it could be widely used by the families that are served at the hub. So we found it a bit more friendly than a survey and a bit less intrusive than a series of in-depth interviews when families came to the hub. And it didn't take very long, which was also really important. We had to be quick.
Thank you. So I see we have 3 more questions and we have about 3 minutes. So let's try and if we can do 1 minute question, that would be great to get through all of them. So question about evaluating the program again. What are the challenges for measuring the impact of the program on the children and families?
I would say we need a lot more time. We need time to see the impact of these families in the long term and also the complexity of the issues that they're facing. So another question, what made it work in Quebec and how can we make it work in Ottawa?
Well, we have the basic principles of the program. As I mentioned in my introduction, the UN Convention on the Rights of the Child is we're working with the guiding principles, but we have to work in each community with the needs. We did a needs assessment and the resources available. Quite simply, it's a process where we are not a top-down planting the program in the middle of a population. We're working together in partnership. So respecting what already exists, and a huge amount existed when Dr. Fraser Roberts and I moved and approached the Vanier Community Centre. There was fabulous centre already, not a health centre, but great relationships in the partnerships. And we've been able to move with a model of low-hanging fruit, work with what we've got and build up from the bottom, not least with the children and the youth and the families themselves. So we are using the principles, absolutely. We're becoming an accredited, we're just going through the accreditation process that we are using their model, but we have to work with our own community. And Ontario is very different from Quebec, as we all know.
And I think just to add to that, I mean, in Quebec, they've been at this for over 25 years. So, they also started with just a couple of centers and have been able to build since then. So our next question, I think the medical students' involvement in the program is an amazing training. Are you able to continue this? And what do the students say about their learning?
Well, they're totally enthusiastic. They're calling me on a regular basis and Stephanie, to try to get in for volunteers. They have to, the first and second year medical students have to do 30 hours of community service learning. And we're on the list for that. But of course, with our minimal resources, frontline staff that you keep hearing about, we're serving our families primarily, and we're trying to encourage trainees, multidisciplinary trainees. We're having social work, psychology, medical students, pediatric residents, in fact, legal. We want to be, so they're very enthusiastic. They get it. They don't need to see the research, actually. They really want to see this model of service. They know that some of them are saying early in medical school, this is what they want to do. So I'm having to give them as much opportunity as possible, but it's not enough for what they're asking for. And particularly in COVID times, with the lack of ability in the hospitals, it's really much more limiting. They've gone to online learning, and the students said that they were in tears when they were leaving the program, each group of them saying goodbye to their families. Some of them wanted to continue with them, and they learned about boundary issues, that was the ending for that, and we had new partnerships. But they've learned so much, and it's been really wonderful for me personally working with them to pick up on the energy and passion. And they've really helped us out in so many ways, and all the publications that they're planning to get this model globally disseminated.
So thank you. We've gone over our time, but I'll try and get to these last ones anyway. So it's great to know that there's a local interest and support for the hub model. What does provincial level interest and support for the model look like? Is there a chance of expanding?
Perhaps I can take that on. Our local MPP is quite supportive of this initiative. But at this time, I think we're working on arguments and presentations to the Ministry of Health and people in position of decision, like to inform them of what the hub is all about, and to demonstrate that it is cost effective in the long run. So those are our next steps to try and convince the Ministry of Health and other potential funders that this model has merit, and we need to invest and start looking at creating this model elsewhere in other communities.
Okay, one last one that I see on the board here, just in case you have time, wondering about the boys and girls and youth in the program. There are a lot more boys. Do you see any reason for this?
Well, I could say that most of our referrals at this time are coming from the schools, and the boys, for example, with behavioral issues. I mean, many of the teachers are saying the child's got attention deficit. Boys, I know, just as that example, are more externalizing in their presentation of attention deficit, and perhaps girls, for different issues, not just from attention deficit, might be seen as more internalizing. So the squeaky wheel is causing the problem, so to speak, and we're getting more referrals from that side of things. I would put it down to that. Alison, did you pick up anything from your outcome research?
I was just typing the same answer actually into the box, the way that the different, but I think one of the recommendations that we felt was how we may need to think about how to reach girls, because the stresses are there. They're just maybe not expressing them in the same way, and maybe aren't being picked up in the same way. So it's one of the things that we talked about in the impact evaluation results.
And I can say for some of the newcomer families, the gender issues within some of those families would reveal a reason for that.
So we've just gone over a couple of minutes, but I'm happy that we were able to answer all the questions that were posted. So thank you for posting those questions, and that's all the time we have. So again, I would like to thank our three presenters and our audience for taking the time to join us today. A special thanks to the Bruyère Research Institute for partnering with us on this event and for helping with the technological side of things. I hope that you have learned about the model and that we will be able to continue to work with many of you in the future. Thank you all and have a great rest of your day. Stay safe and healthy, and watch, if some of you are driving home, be careful on the roads. Thank you very much.
Thank you.
Thank you.